Hello and welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Very glad that you could join us here once again. You know, over the past decade or so, healthcare organizations have invested millions and millions of dollars in patient portals in an effort to better communicate and engage with consumers. Now, our guest today is Mr. Michael Morgan, CEO of Updox. Updox is an industry leader for care coordination and CRM solutions, and he's joining us on the program today to talk about the need for healthcare providers to offer a choice beyond portals. Welcome to the program, Michael. Thanks for joining us today.
Thank you, Neil. Happy to be here.
So when we're talking about portals, well, before we jump into the need for a choice other than portals, give us a bit of background about yourself above and beyond being CEO of Updox. What brought you to Updox?
Yeah, so super excited to be at Updox because we have a big goal of simplifying the business of healthcare. And as most people know, as being patients, there's a lot of frustration around healthcare, whether you're a patient or even the staff and the physicians as well. There's just a lot of paperwork, a lot of manual effort. And our goal was really just to help simplify all those processes and just make it easier for both patients and the physician.
So how is it easy to simplify those confusing and complicated processes?
Well, a lot of it is really giving the staff and the patient what they need to do their jobs better. There's a lot of manual and wasted processes today, whether it's paper coming in, paper that's results of a lab result, and then trying to call a patient. So an example we use a lot is 50% of the time a lab result's normal, but it takes a physician's office 3 times to call a patient and connect with them just to tell them that it's normal. So the patients are on edge, they're wanting to know, the staff is on edge, and they're trying to manage all of these phone calls. And so we give them solutions to help them automate those processes and reach the patients where they are, which a lot of times their mobile phone and being able to use texting.
Would you say that there's a difference in how healthcare industry as a whole views patient engagement as opposed to how specific healthcare providers, the doctors that are actually, in the trenches, view engagement?
Yeah, I think there is actually a disconnect. Everyone would agree that patient engagement is important. And I think the industry is really starting to recognize that patients are really starting to become customers, and they are consumers. And so they're trying to give them what they want. So I think the first step is a good recognition that is really important for the industry. But you're right, there is a gap because traditionally patient engagement has been equated to creating patient portals. And probably people have heard those words. The problem is a lot of those portals were created as an offspring of government mandates, and it really just provided a way to deliver the clinical record to the patient. Meaning, if you wanted to go log on to the portal, you could download your clinical record. But that's not really making the patient's life easier. And that's been the real big disconnect because what the portal was intended to do is not really the way the patient wants to interact with the physician's office.
So how do you see patients viewing engagement? What is the consumer's view? What are they looking for?
Yeah, no, I think that's great because reality is a patient really just wants to be educated and informed and make it very easy to collaborate with their healthcare professional or the staff. It's really a care team, and that's what really creates a better outcome and a better experience for the patient. And what they're looking for is they're carrying around a mobile phone, and they want it to be as easy as being able to communicate as they do with anybody else, but obviously they're also concerned about security. And the problem is a portal requires that patient to come out and do something different and go log in. And a one-size-fits-all model doesn't work. And so really having options as a patient or as a consumer, if I want a text message, if I want to download an app, I want to choose the way. I may even want to do video or I want to do other things. And so providing a range of options for the patient, enabling it and making it easy for them to connect with that staff or that provider, that's really the key, and be able to do it on their own terms, but in a way that's also productive for the staff. And so being able to bring those two things together, easy for the patient, easy for the staff, the way they want it, meet that patient where they are, and not make them do something different is really the key.
Is being able to pinpoint specific information within your record important to patients as well as caregivers when it comes to transmitting and analyzing this information between the two?
Yes, I think it's it's being able to pinpoint and find specific information, and that's really a key thing. But I think in addition, taking that one step further, that once I've identified a piece of information, being able to make recommendations, educate that patient, and follow up. So, for example, a high proportion of people that are newly diagnosed with diabetes don't actually show up for their first appointment after that initial diagnosis because they're concerned or they're scared. And if you think about having a very engaging patient tool where you can not only communicate that diagnosis, but then if it feels like it's comfortable for them to ask questions, provide them educational information, then they're more prepared when they come in. They'll actually adhere better to their therapy. They're happier, but then there's also better outcomes. And it actually creates a better situation for the entire system because you have better outcomes with lower cost, which is actually the big goal of healthcare.
Do you think that some of the confusion within the healthcare industry when it comes to patients understanding the information that they're getting and understanding, I guess, the HIPAA requirements that are being adhered to when they're dealing with this information? Do you think that educating patients, consumers, is high on the priority list as far as most platforms are concerned?
Yes. They want to, and if you look at the way that they have to be educated, I think they're also learning, and there's some similarities with some other industries as well. And they do need to be educated and understand how all this can work together. And I do think that's a key piece. And so there are consumers or patients that are learning how to use some of these newer technologies. But what's nice is with healthcare starting to take advantage of tools that patients are used to using, that learning curve actually happens fairly quick.
Where can our listeners go online and learn some more about Updox and some of the technology that we've been talking about this morning?
Yeah, so to learn more about Updox, you can visit our website at www.updox.com, and that is updox.com. And there we'll talk a little bit more about the platform we provide and how we actually offer one place where they can bring together all this communications that they have to do with other providers as well as engage patients. And it's really bringing it together into one collaboration platform that really acts as a CRM or customer relationship management system for these providers. And so giving them that one place that they can manage all the communications, it makes staff happier, and it also gives patients the types of tools and the way that they want to engage with the providers.
Well, Mike, thanks for coming in and talking with us today.
Thank you, Neil. I really enjoyed it.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.